Hi, I'm Tim Deere. I'm an interventional pain physician from West Virginia. Well, I think it's very important that we keep examining what we do and making sure we're doing the right thing for patients. So the talk I'm giving at this meeting, the Systematic Review of Neuromodulation, really summarizes 4 articles I published last year with many of my colleagues. And the articles looked at the evidence and the grading of evidence for things like spinal cord stimulation, brain stimulation, peripheral nerve stimulation, and dorsal root ganglion stimulation to really look at where we've been successful in providing good evidence and where we've been really needing more evidence. And so I'm going to review that in a very kind of concrete way. And we're going to look at the evidence where it is today. And I hope it gives us a roadmap of where we need to go with research going forward. So I think the findings of the Systematic Review of Neuromodulation lecture will show that there are some great studies out there. For example, in the area of spinal cord stimulation, we have 3 or 4 really well done level 1 evidence studies. Dorsal root ganglion stimulation, we have some well done level 1 research. And then in peripheral nerve stimulation, we have several prospective studies, but we need, I think, a new one there. Brain stimulation for pain, the research is pretty minimal still. So there needs to be a lot of research, like things like atypical facial pain and things like that haven't responded to other therapies. So I think spine and DRG have great evidence. Peripheral has pretty good evidence, but not great as of yet, but hopefully it'll get better. And brain is lacking at the moment. No, I think that the field of neuromodulation is evolving, but the field of interventional pain is evolving as well at the same time. So we're seeing more and more patients who are appropriate for new techniques. For example, a few years ago, if you were having, for example, a fusion of your sacroiliac joint, you would have needed to have 3 large screws from the lateral approach. And that's still done by some and certainly a reasonable approach. But now there's more minimally invasive ways to do things where there's less risk, less expense, and the outcome appears to be at least as good, maybe even better over time. We'll show that. So I think we're seeing an evolution where neuromodulation remains an important part of our practice, but we're seeing more and more minimally invasive spine techniques that will actually lower the risk for patients and the cost for society. And as we get more research going on those areas to provide evidence, I think we'll see access for patients improving. So this field is changing quickly. It's changing for the better for patients. And I think all those things are very important.